session, so let's get started. Hello, everyone. So my name is Christina Valenti. I'm the Senior SDOH Advisor for Contexture, and so we're here to review the SDOH DAP 2025 milestones and get ready for kickoff for the new year, which starts October 1. So just a few housekeeping things. So we have disabled the chat, and we have done that with intention. For all questions, we want you to use the Q&A tab at the top. You should see at the top of your meeting to insert all of your questions there. We have our team, our SDOH DAP team, who is going to be reviewing all of those questions and answering them in the chat. We do ask that if you put in a question to please also include your organization that you come from, so that your specific SDOH advisor can reach out to you if there are more in-depth responses needed. We'll go through they'll try to answer the questions as we move through the webinar. We'll have time at the end we'll give about 30 minutes for questions. So if you want to ask a question, then you can. Any questions that we don't get to in the Q&A, we'll also address them at that question section. The other piece is we are recording this meeting. So the beginning, most of the part that I'll be covering and some of the pieces Sebastian will cover will be recorded. However, once we get to the demo of the platform, we will stop the recording for Unite Us's proprietary information. They don't share the visible platform in recordings. So we'll turn off the recording then. So if you have demo or platform specific questions you want to see in the platform, please ask those questions before we go back to the main question time. All right, so there's just housekeeping things. So let me get this. Okay. All right, so like I mentioned, I'm Christina, and I'll let Sebastian introduce himself.
Thanks so much, Christina. Good morning, everyone. My name is Sebastian Blackwell. I'm a customer success executive with Unite Us, the technology that powers CommunityCares. Really excited to share a demonstration of the platform today, especially the screening functionality. Tons of familiar faces or names rather in the room. Really excited to be here with you. Thanks, Christina.
Awesome. Thanks, Sebastian. So this is just an overview of what we're going to go over today. So we are going to first go over the milestones, then talk about the quarterly meeting requirement, talk about screenings, and then go over data and insights, and then a platform demonstration itself, and then next steps and questions at the end. All right, so for SDOH DAP 2025, the milestones are broken up into two cohorts. So cohort 1 would be any organization who participated in SDOH DAP 2023 and or 2024. So they already have participated in a previous year. And so the milestones, there are 4 main milestones. The first one is signing and submitting your SOW and CommunityCares agreement, which you all have already done. And then milestone 2, which is to define and review your goals. So you are meeting with your SDOH advisor in a post-live meeting to discuss training needs, screening referral workflows, implementing that screening tool, and define goals. So this meeting here, this webinar, will count towards your initial meeting that's listed in the milestone that has to be completed by September 30th. So by attending this webinar, you are meeting that milestone and requirement. If you would like to have another meeting on top of that with your advisor, you can reach out to them and request a meeting if you have more in-depth questions, and I'll go over a little more what that looks like. Milestone 3, which is screening and referrals, so using the platform. And with this year's goals or how they're being tracked is a combination of screenings and or in-network referrals. So previously in 2024, it was in-network, out-of-network, internal cases all counted towards your monthly requirement. However, with 2025, that has changed and it now is a combination of screenings and or in-network referrals. And then also that number that you will have each year monthly requirement will be based off of a 5% improvement of your 2024 sent referrals. And so it's no less than 10 a month, depending on your referral numbers. And then the last milestone, which is a quarterly touch base. So you'll be asked to check in or meet with your SDOH advisor on a quarterly basis to review your progress towards your goals, and if needed, to complete an improvement plan to make sure we get back on track to getting you to meet the numbers that you have to. And cohort 2. So cohort 2 is an organization who has not participated in SDOH DAP 2023 or 2024. So they're brand new, or location or provider brand new to the SDOH DAP program. So they only have 3 milestones. The first is signing in and sending in that SOW in the CommunityCares agreement. And then milestone 2 is to onboard and utilize the platform. So it's to complete that onboarding process by January 1, which means you need to be live on the platform by January 1, not beginning the process by January 1. So you need to be live by January 1. And then utilizing the CommunityCares platform with a combination of screenings and or in-network referrals. So it would be 10 a month. And then milestone 3, which is that quarterly touch point as well. And so you'll be meeting quarterly with your advisor via email or in-person meeting, well, online meeting. You can have in-person if you like. You can request with your advisor. And to do an improvement plan if needed, if you're having difficulties meeting your monthly requirements. So a little bit more about those quarterly meetings. So depending on your progress towards your goals, those meetings can range from either an email check-in where your advisor will provide you with your post-live support worksheet, which will detail all of your site locations or providers who are registered with the SDOH DAP program, and then their meeting or the referral requirements. And so with this document, we'll keep track of the number you're supposed to be meeting and the actual number for that each site location. And so if you're meeting your goals, that could just be an email where we provide you this information. If everything looks good and you don't have any questions or needs, then we're just confirming receipt of this worksheet. If you have questions or you want to have that meeting, even though you're doing well, of course, we will still love to meet with you, chat with you, talk about any of the things that are going on with your organization. If you are having trouble meeting your goals, that would most likely be a meeting with your advisor to address any of those issues or concerns that are making it difficult for you to meet your monthly requirements. We'll talk about workflows, we'll talk about that might need training needs or retraining needs. And so that's the intention of that meeting. And so if you are having difficulties in that quarterly meeting, you might be placed on an improvement plan. And then if it continuously happens, definitely have to be on that improvement plan and discussion about what it would look like moving forward. We really want to emphasize your organization tracking and monitoring your referrals and screeners each month on your own. We're here to support you and track those goals at that quarterly basis, but it's really important that each organization stays on top of their monthly requirements so that you don't fall into that basis of being put on that improvement plan and risking continuation in the program. So screening leads to success. So one of the big changes with this year's SDOH DAP milestones requirements is including that screening as a way to meet your requirements. So a combination of screening and in-network referrals. And the intention with that is we really feel that understanding your community and your patients and what their needs are is really important. And it really help identify where we might be having some gaps within the state. So really completing those screenings is the best way to identify the types of referrals that your patients or clients may need. So the prepare screening is already available within the platform. Sebastian's going to go over what that looks like during the demo portion. So that's already there for you. If your organization uses a different screening and you're interested in creating that custom screening within the platform, that is available to any organization to use or to implement, and that would consist of a couple of meetings where we kind of crosswalk your screener to Unite Us, and then they will build that for you in there so that you can use your screening to generate those referrals. So that would be the most ideal kind of workflow, is starting with that screener, completing that screener in the platform, and then based off of that generation of referrals, sending referrals in there. So then if you do that screener, you get 1 credit, and then however many referrals are created from that, whether it's 1, 2, 3, or 4, could be, you know, a total of up to, or however many you send, but more than just that 1 credit. So integration is available if you have certain EHR systems. There is a capability with Cerner and Epic integrations called the screening ingest, which allows you to complete the screening in your own EHR, and then that information is then sent to Unite Us for you to create those referrals off of. So you still get credit for that screening ingest, and then the referrals that are created from there. That is, you know, the most ideal way to do it because it's the easiest. It's in your EHR. So if you're interested in integration and you have Cerner or Epic, please reach out to your SDOH advisor for that. There is a cost associated with an integration. The first year of the integration and the startup costs of the integration are covered by Access. However, any year after that would have to be covered by your organization. And if there's any costs associated with your from your EHR, then you would have to cover those as well. We do say that as participating in the SDOH DAP program, you're receiving that enhanced incentive reimbursement on your funds to Access. So you can use some of that money that you get from that to cover the costs of the integrations in the future. I'm not sure if I just mentioned, but the cost would be $10,000 any subsequent year, which we had worked with Unite Us to negotiate a reduced fee of that $10,000. So if that's something you're interested in, please reach out to your SDOH advisor. And then I'm going to pass it over to Sebastian, who's going to go over what the screenings look like in the platform and then the demo. So Sebastian, over to you.
Thanks so much, Christina. Great. As Christina mentioned, Unite Us does allow you to capture health-related social needs via screening in the platform. So this is what we'll demonstrate today in the tool. As she mentioned, this is available. So if you all would like to utilize the Prepare Screener, it is open in the Unite Us tool. And the screenshots you see on the screen are what we'll go through in the demonstration. Go to the next slide. Not only is it valuable from my perspective for you all to use screeners to help meet your SDOH DAP needs, we also believe that the screening will support your end users in addressing the needs of your clients and patients in the community. So currently, if you don't screen and Unite Us, your team may be identifying needs through a screener, maybe outside of the system or through conversation with clients and patients. The value of administering, for example, the Prepare is your team is able to use the form to identify needs, and the system will prompt you to generate referrals based on responses to the screening question. So that's what we'll show today. And on the right-hand side, you can see that based on the results of the screener, there's a service subtype suggested, which helps your end users automatically suggest, rather the system automatically suggests referral pathways to help get your patients and clients connected to the right resources quickly. To the next slide. So you all may have seen a slide similar to this where we go through, following the journey of a particular client in their referral process. It's just as simple while we utilize screening. So this is what I'll show in the tool, but just to highlight visually, you can imagine, Katie shows up to your organization and to an organization to receive services. The end user can then utilize Unite Us, so launch the platform, which I'll show you today, administer a screener, whether that's the prepare or a custom screening we build for you all. And through the screening, identify a social determinants of health or health-related social need. In this case, Katie's being served by the individual you see on the left. Through screening, we're able to see that Katie has 3 needs, in this case, food insecurity, childcare, and transportation. The system then prompts the end user to generate referrals and capture consent, just as always. So once the individual, in this case Katie, consents to a referral or referrals based on the need, those referrals are sent on to organizations in the community to provide the service, and resolution or outcome details are documented, and the end user at the hospital gets feedback on what happens with those referrals. So essentially just adding a step here in the process to administer the screening, which hopefully will save some time with needs identification as the referrals are processed. So this is what we'll demonstrate in the tool today. Go to the next slide. Awesome. We also want to highlight here, and I'll pull this up after we demonstrate the screening to referral process in the platform, is your ability to access this data. There's really 2 ways that you all can access data in the via CommunityCares. First is what you see demonstrated here on the screen. It's through Unite Us Insights. Insights allows you to track organizational activity, particularly referral activity, and measure your impact. So you can follow the journey of those referrals that you've generated. Screenings are available in exports, and that's on our next slide here. But, big picture here, we want you to understand that the data you're generating in the platform is yours. We hope that you use the Insights product, which is provided to you by CommunityCares, to help drive your strategy, be able to track, is your team sending referrals into which organizations, and what were the outcomes of those referrals at an aggregate level. So just a reminder, you do have access to Insights. If this doesn't look familiar to you, make sure you connect with your SDOH advisor. We also have a form you can fill out to access those 3 users that get access to Insights, and we'll provide that in the follow-up today. Go to the next slide. The other place that you can access your data is through in-application exports. And I'll show you how to do this in the tool today. But this allows you to pull raw client-level data out of the tool. So any organization administrator at your organization can pull the data, including the screening data that you all generate. And I'll show you how that looks, but it's pretty simple. It's through a CSV or an Excel. We also have a helper document that we're going to send out after today's webinar that details how to utilize exports. It goes through the definitions, talks about best practices when using Excel to create pivot tables so you can really measure your impact. So we'll be sure to have that in your inbox after today's call. To the next slide. The other 2 dashboards, as I mentioned, that you can track referral data specifically, that you have access to through CommunityCares. First, it's called Network Activity Dashboard. This is where I would anticipate you all would spend the bulk of your time, at least at first. This dashboard is really useful for those who have used it. You can find network coverage as an example. So you can see like how many organizations are there in your county, and of those organizations, how many programs are there who are open to receiving referrals. So you can track that. You can drill down into your organization specifically and take a look at your overview of how many clients you've served and basic demographics. You also can track referral data and document the number of referrals your team has sent over time. That's what I'll show you today, and that's what I think is important for SDOH DAP. But we're just going to show just a small portion of Insights, but please know there's tons of data you have access to, and our your team, including your SDOH advisor and myself as your customer success manager, we're here to help. Go to the next slide. The other dashboard you have access to is called the Health Equity Dashboard. We're not going to demonstrate this today, but just want to make sure you all are aware that you have access to this. It allows you to do some deep dives into demographics. So if you have particular populations you're focused on, you'd like to see how they're being served in Unite Us, where there might be gaps, this is a great dashboard to do it. So just to review, there's two places to get data and pull that out of the tool. The first is exports. That lets you pull the raw client level data out. That's where you'll find your screening information. You also have access to Unite Us Insights. That gives you dashboard context. You get the network activity and the health equity dashboard. So two places to find data. Go to the next slide. The team has also asked that we share some of the data model definitions. I think this can be helpful as your team is getting familiar with the exports and insights. Now, we're kind of going rapid fire here. Please know you don't need to memorize this, but you may see language both in the exports and in insights that talk about cases and referrals. As a reminder, referrals, that's the metric that you're being tracked against for SDOH DAP. So a case is the highest level of data at Unite Us. We identify a case almost like a need, right? So when a need is identified and your team attempts to send a referral or create an off-platform case, that's when a case is created. Cases can have referrals underneath them. So you'll see both of those pieces in the platform, but referrals, that's what we're going to focus on because that's the SDOH DAP metric. And what that essentially means, and you see it bolded here, is your team's attempt to connect an individual client to an existing organization in the platform to provide service for that health-related social need. Referrals is what we'll show. We'll also send out within the exports document I described before and all of these definitions. So again, you don't need to memorize this, but I think it can be helpful as you all are interpreting your data. Go to the next slide. Great. So, the next piece is really to show you all a platform demonstration. This is where I'll walk through the full workflow on how your team can launch the platform, administer the screening, that therefore identifying needs and generating referrals. So we're going to go through quite a few steps here. Something else we'll include in our follow-up, however, is a walkthrough, step-by-step guide on how to do all of this. So hopefully you've seen it before, and if it's brand new, that's okay. Don't be nervous. You don't have to memorize it. We have guides that exist in the platform, and that we'll send as a follow-up for you to go through step-by-step. After we do the demonstration of the tool, I'll also show you, an at-a-glance look at where to find this data, both in exports and in insights. But if you have continued questions, as always, you can reach out to your SDOH advisor, and we can make sure you have all the info you need. So for now, Christina, I'm going to borrow the screen.
Sounds good. And then also just a reminder I said at the beginning of the hour is that we cannot record the demo portion. So I'll be turning off the recording. And then if you have any questions specific to the platform itself, please ask those while Sebastian is in the demo site. Because after we finish with the demo, we're going to open up for questions, and we want to turn the recording back on. But if we have to keep going back and forth, it makes it a little harder to keep turning it on and off. So please, if you have a question, you can raise your hand and I will turn on your mic so that you can ask the question about the demo piece. So let me, and then we can hop into questions. So what's next? So look out for an email from your SDOH advisor, which will include the post-live support worksheet, which will list your SDOH, your goals for 2025. And you should see that email by September 30th. So especially for that cohort 1, if you participated in the previous years, your 5% increase will be included in your goals, and you'll know what that specific number is for each of your access access IDs registered for the program. So if you have providers and combination of providers and site locations, all of that information will be listed for you in that worksheet, and it will list out the site locations, the number of referrals that you're required to send. Please reach out to your SDOH advisor if you have any questions or would like to set up a specific meeting, anything that might be going on with you and meeting your requirements. And please remember to connect. We will connect with you quarterly or connect with us quarterly so that we can continue to help you monitor your goals and help you meet your requirements. Let's see. All right. We could open up for any more questions. Anyone who wants to come off mute. If your question didn't get answered in the chat or in the Q&A and you want to know the answer now, we still have time. We have about 10 minutes to get to as many questions as we can. So let me see. Robert, you should be able to come off mute.
Yeah, I just popped this one into the chat box, but the relationship between the HIE pricing model that's been proposed for 2026, I believe, does that impact folks that are only wanting to access the CommunityCares platform? The proposed pricing is going to cost more than the DAP incentive payment. So like we'd be at a net loss if we were to continue. And so trying to understand, navigate, is there still inherent value and even attempting to participate in DAP given the contextual pricing model?
Yeah, so there are 3 different DAP programs. There's the HIE DAP, the SDOH DAP, and the AZHDR DAP. For the HIE DAP, that is completely separate from the CommunityCares, the SDOH DAP. So you can participate in just SDOH without participating in the HIE DAP. And there isn't any cost associated with participating in CommunityCares. So all of that enhanced reimbursement you receive for the SDOH DAP, you will continue to receive. If you choose not to participate in HIE DAP, that's a decision your organization can make because of that fees that it will be coming. You can make that choice. So it's not an all or nothing. You can pick which programs you would like to participate in.
Perfect. That's helpful.
Does anyone else have a question they would like to ask? If not, then Ariel, is there any questions that you would, or Kelly, do you have a question, or not a question, but see a question that we should answer?
Let's see there. Yes, Christina has a question. Christine Barrington, regarding the number of CBOs within her area. She lives in a remote area. We've sent the list of companies that are still not on the platform. What is the best way to get CBOs in her area connected?
Yes, so if you completed a partner collection spreadsheet and submitted that to your SDOH advisor, we have connected that with Sebastian's team, and they are gathering that information and putting it on our side to outreach those organizations. When you complete those community or partner collection spreadsheets, it's really important if you can include any contact information to those organizations or any direct person that you work with there, because it makes it a lot easier for us to connect with that organization if we essentially have someone we can say, Christine recommended that you join because they use this platform. It works a little better. Also, we have information sessions that are held weekly for organizations who are interested in joining the CommunityCares program, whether they're CBOs or other healthcare organizations, which you could direct them to. Your SDOH advisor can send you kind of the templated email that we have shared with other organizations, that they have shared to organizations that they connect with, to kind of, give them a suggestion to join the platform. And they can just join any of those information sessions to learn more about the platform and then begin the onboarding process. I'll also let Sebastian hop on if there's anything else he wants to add to that, because his team is one of the main ones who works with onboarding CBOs. And I also did see another question about how many people or how many organizations are on the platform now. And so I know Sebastian would also know the answer to that question.
Thanks, Christina. And thanks for y'all for your question. You're right on. You know, if you've submitted a partner collection sheet, thank you so much for that. Our team has taken those, attempted outreach to organizations. Just to underscore what Christina shared, you know, we've seen the most success for organizations coming on if there's a warm handoff. So, you know, just highlighting, feel free at any point to connect those community-based organizations that you know directly to your SDOH advisor or anyone at Unite Us. We are always attempting to onboard new organizations. And we do have weekly, which we'll send in the follow-up, weekly community information sessions where orgs can come, learn about the platform, learn about the benefits. You can also invite your preferred partners directly to those. And I did want to show you in the tool itself in Unite Us Insights, when you all access this, you have the ability to answer that question. Who's on in my area? How many programs are there open to receiving referrals? So I'd just like to show you in Insights, we spent some time here in the referrals section. But if you go to the network coverage section, you can filter by county and you can see how many organizations are there on the platform. Of these organizations, how many programs exist, and then the programs listed, which percentage of those are open to receiving referrals. So, you know, I do want to just add here, that's a great place to go to answer that question. And you can take a look at all of those programs to see, you know, what is the most common service type, for example. And that's in addition to what you can see in the My Network tab. So kind of two parts. Please invite orgs to join, and we're happy to, if you connect with your SDOH advisor, we can give you tips and tricks on that. And you always have the ability to see who's on and open to receiving referrals. And this is data from Unite Us in Arizona.
All right, we may have time for one more question as it's 12:27, so we want to respect your time. Like I said, if there are questions we didn't get to in the chat, we will definitely respond to them in our FAQ that we will send out. So does anyone else have a pressing question they would like to ask in our last few minutes? Okay, all right. Thank you, everyone. We'll stay on for until the end of the time, just if anyone wants to hop on. Oh, I see one. So please reach out to your SDOH advisor if you have questions. You'll hear from us by the end of the month with your requirement for your goals. Thank you all so much for participating. I appreciated all of your input and questions. Have a good day. Jeannie, you could come off if you'd like. Jeannie, are you able to unmute yourself? Hi, yes, we can hear you.
Oh, thank you. I just couldn't find the mute thing.
Okay.
Sorry. Quick question. When we're reading the consent, capturing the consent and it's over the phone, is it important to read it word for word, or can we paraphrase it just so they understand what they're consenting to? Because it does take a while to read that and it's very formal sounding. And I have been reading it all word for word, but does that matter or can it be paraphrased?
Jeannie, I can attempt to take that question. Our consent form is written such that it should be read verbatim. Definitely understand though that it is lengthy. Apologize for that, but that has been approved verbatim by our legal and compliance team, just to ensure that we're protecting the privacy of the individuals we're serving. So, long answer to say we would recommend reading that word for word.
Okay, sounds good.
Jeannie, there also is the capability for you to send that to them via text message for them to either agree or disagree to that consent. I don't know if that will help you in limiting how much you have to read.
Well, we can't text from our office. So.
It will be from the platform. So the platform sends it for you to the individual.
Oh, okay. And then they can send it back
Yes.
to the platform?
Yes.
Okay, I never attempted that. Okay, maybe
they don't have to send it, Jeannie. It will, as soon as they hit submit, it'll automatically populate. So there's some value there for sure.
Okay, maybe I'll try that. I didn't understand what it meant when it said text.
Yeah, if you have questions about that, we can we can include your advisor and they can connect with you to kind of walk you through what that would look like specifically.
Okay, no, I think I understand now, but thank you so much.
Yeah, of course. Samantha, I think will be our last question. Go for it. You can come off mute, Samantha.
Oh, thank you. I didn't get to catch most of the meeting. Will this be recorded somewhere, or can I have it sent to me, or the slides?
Yeah, we are recording it right now, and
Okay.
It will be on our website, and also we are going to send some documents along with it. So all of the questions, the Q&A, and some other supporting documents will be sent via email, and then will also be placed on our website for you to view. So as soon as it's live, we'll let you know.
Okay, and that's on Contexture website?
Yes.
Okay, perfect. Thank you so much.
You're welcome. All right. Thank you, everyone. I will close out the meeting now. I appreciate all your time. Bye.